for.
Dido Harding, Baroness Harding there. We've been obviously very focused on the government's announcements in the last hour or so, but of course this pandemic is a huge issue globally still, and coronavirus infections have passed the 2 million mark in Brazil. Nearly 77,000 people have died there with the virus, the second highest figure in the world after the US. Well, Gustavo Ribeiro is author at the Brazilian Report. Thanks for your time. Do we have a really accurate picture of what the numbers are in Brazil?
Absolutely not. The confirmed cases are just a fraction of the real extent of the pandemic in Brazil. Experts say that the figures could have already topped the 10 million mark in terms of cases, and we are actually never going to know the full extent of the outbreak because Brazil lacks accurate testing. We never had massive testing in the country. Among the top 10 countries with most infections, only Mexico and India have tested fewer people per million than Brazil.
Who has been most badly affected?
The Amazon states are the ones which show higher mortality rates and higher infection rates per million people. And now the outbreak has slowed down a little bit in big urban centers, but it's spreading fast in the interior of the country, where we have a feeble healthcare network, where we have fewer ICU and we have fewer hospitals. So we should expect a bump in deaths in the near future.
And of course, like many countries, there's a big informal economy with people not being underpinned by, any measures to prop them up, to keep them going.
Exactly. In Brazil, we have tens of millions of people. It's not that they're living paycheck to paycheck, but they have to go out and work every day in order to make ends meet. And the government has been criticized a lot for having been slow to enforce a coronavirus stipend of 600 reais, which is around 110 US dollars. It doesn't sound like much, but it has helped millions of people avoid falling below poverty line, and it has been a major source of income for millions of people. The government, however, says that the government is cash-strapped and there's no way it can continue this stipend for more than a couple of months ahead.
And what about the public health service itself? Of course, again, every country is facing huge challenges.
Well, Brazil is an enormous country, and we have different realities depending on the state. When we talk about São Paulo and Rio de Janeiro, we talk about a more developed healthcare network. When we talk about the Amazon, it's a whole different story. You have, for instance, in the state of Amazonas, where we have the biggest city in the Amazon, only the capital city of the state has ICU. And for many people, they have to get on a boat and wait for hours before reaching an intensive care unit. So when we talk about the network in Brazil, it really depends on where you are to discuss the quality of the healthcare service you're going to have at your disposal.
Okay, Gustavo Ribeiro, many thanks indeed.